Well, thank you so much for inviting me here today. I'm really excited to be here. As Amanda said, I'm Kristen Sullivan, Director of Prevention and Survivorship at the American Cancer Society. I've worked at ACS for about 16 years now, so it's been a while. And my primary area of focus is nutrition and physical activity. And today I'm excited to talk about physical activity and its relationship to cancer prevention, survival, and wellness. Okay, so today I'm going to cover the role of physical activity in reducing the risk of getting cancer, as well as the role of physical activity in cancer survival and quality of life. And I just want to give a special shout out to my colleague, Dr. Erica Reese-Punya. You'll see her name on a lot of these slides. She's a researcher who has done a lot of work in this area, and I'm going to be quoting some of her research. And she also helped contribute to the slides. Okay, so just to start from the beginning, what is physical activity and how much do I need? So I think we all kind of have a basic understanding of what we mean by physical activity, but there are some differences, especially when we're talking about how we collect data to look at health benefits of physical activity. So generally, physical activity is essentially any movement that results in an increase in energy expenditure. So this could be things like walking to work, folding your laundry, or going out for a run, lifting weights. We generally think of exercise as something that's a little bit more planned and structured, and it's also done with the intent to improve health and fitness. So exercise is a type of physical activity, but not all physical activity is exercise. And the way that we tend to quantify physical activity is with something called the FIT principle: frequency, intensity, time, and type. So frequency is essentially, how often are you doing it? People say you should exercise 5 times a week or something like that. So it's generally how many times a week. Intensity speaks to the effort that's exerted during that activity. So it can be light, moderate, or vigorous. For most of the research, we're really looking at moderate to vigorous intensity physical activity. And that's what we generally measure to impact health outcomes. And then time, of course, is how much time you're doing it per session. And then there are two kind of broad types of physical activity that you'll hear talked about. One is aerobic, or what people might consider cardio, so things that get your heart rate really elevated. And another is muscle and bone strengthening, also often called resistance or strength training. And then I'm also going to be talking about kind of the flip side of physical activity, which is sedentary behavior. And so this is really any behavior that's really characterized by very low energy expenditure, primarily while sitting down or lying down. And this is meant to be behaviors that are happening during your waking hours. So of course, everybody needs their 7 to 9 hours of sleep a night for general health, but this is kind of that like sitting around during the day or the evening when you're not sleeping. And it's typically described as like an activity that you're doing. So you may be watching TV or playing video games or things like that. So how much physical activity do we need? Well, there are quite a few guidelines and recommendations out there from different entities and organizations. These are the federal government's physical activity guidelines for general health and well-being. They recommend doing moderate intensity aerobic activity, at least 150 minutes a week, coupled with at least 2 days of some sort of muscle strengthening activity. So lifting weights or some sort of resistance training. They also specify that if you are more apt to do vigorous activity like running, that would be the recommendation there would be 75 minutes a week of vigorous activity. So moderate intensity would be things like going out for a brisk walk, taking a bike ride that's not super strenuous. Whereas vigorous would be like a game of basketball where you're running up and down the court for most of the time, going out for a run or doing a bike ride that's very fast or hilly. And then just a note down here that they also specify, essentially put into our own words, my own words, that some is better than none and more is better than some when it comes to physical activity. And I have a slide where I'm going to go into that a little bit more in just a couple of minutes. So what do we know about cancer prevention and physical activity? Well, the American Cancer Society, every 5 years or so, we get together a big group of experts in the field and we review all of the research and new evidence looking at nutrition and physical activity and its risk to cancer. And then we publish guidelines. So our latest guidelines were published in 2020. And for physical activity, we recommend for cancer risk reduction or cancer prevention that adults should get from 150 to 300 minutes of moderate intensity activity a week, or 75 to 150 minutes of vigorous, or a combination of the two. And that children and teens should be active for at least 1 hour every day. And then we also make specific recommendations to limit sedentary behavior because we are seeing in some of the research that it's kind of separate from how active a person may or may not be, that having a lot of sedentary behavior or sitting time is also associated with higher risk of cancer and higher risk of death. We don't really have as much research on sedentary behavior as we do on moderate to vigorous physical activity. So there's not really enough to say, you need to limit it to X amount of hours per day. But a basic rule of thumb is for people who are sitting a lot with their jobs or just being at home, to try to get up and move around for a few minutes every hour. And a lot of our smartwatches and devices kind of have that programmed in. Well, they'll kind of ping us at 11:50 if we haven't moved at all that hour to get up and just walk around. Okay, so and we also recommend that getting any amount of physical activity is better than getting none. This slide is a little bit busy, but I just want to draw your attention to the yellow square here. So what we're looking at is on the horizontal axis is the amount of leisure time physical activity that people report from 0 and then increasing as you go to the right. And then on the vertical axis is essentially all-cause mortality. It's essentially your risk of death. So what we see is when people move from doing 0 amount of activity to some activity, not quite meeting guidelines, but getting some activity, there's a massive drop in the risk of death. And that's the kind of some category in the yellow box. So there's huge benefit in just doing some amount of physical activity, even if you're not meeting those recommendations. Definitely not all or nothing. We see that line, that risk of death, drops even more when people kind of reach the tan bar, which is meeting the recommendations or exceeding them by a little bit. And then from there's a little bit more benefit to doing a little bit more, but not a huge amount of benefit. And then it kind of levels out. So there's no real risk to doing more physical activity, but you're going to see the most benefit from going from that 0 amount to any amount, and then a little bit more benefit as you start to meet those recommendations. So I think one thing that I really want to drive home is that if 150 minutes or 300 minutes seems completely out of reach for people, that that may be a goal. It doesn't have to be a goal, but a goal could be just doing some physical activity every day, and it's going to benefit your health. Okay, so what about if you are physically active, you're meeting your guidelines? Is it okay to sit a lot for the rest of the day? So this is an interesting study where they looked at people and categorized them by those who were getting a lot of physical activity, and then kind of on a scale down to those who weren't getting very much at all. And you can see that even this, the dot in the gray box, these are people who are meeting physical activity guidelines, getting a lot of physical activity every week, but also sitting a lot, sitting for 5 or more hours a day. And their risk of death still is above that dotted line, meaning it's slightly elevated. Of course, it's not quite as bad as the people all the way to the right that are not getting any physical activity at all and also sitting a lot. So that's worst case scenario. But this is just to kind of illustrate that that the sedentary time is kind of somewhat independent of the amount of activity a person's getting. So really important in and of itself to make sure that you're limiting sitting time. So how are we doing in the US as far as physical activity goes? Well, this map shows, it asks a question. This is a nationwide survey that is done by the federal government. And the question was asked during the past month, other than your regular job, did you participate in any physical activities or exercises such as running, calisthenics, golf, gardening, or walking for exercise? So if a person answered no to that, they participated in no leisure time physical activity, they were considered physically inactive. And what you can see here is the states in the orange and the dark red are states with pretty high rates of no physical activity at all. So anywhere from 25% of the population upwards of 30%. Most of the rest of the country is about 20 to 25% of that state's population is physically inactive. And then there's a couple of those states that kind of hang on in the lower ranges of physical inactivity. They tend to be states that have a little bit of a culture of being outdoors and doing a lot of outdoor activity. So, we definitely have a ways to go, at least in this country, to increase our physical activity levels. Cancer survivors. Well, it turns out that they aren't really meeting physical activity recommendations either. This was a study from 2020, and it essentially shows that anywhere between 85 to 93% of cancer survivors aren't meeting those physical activity guidelines. But I think you should note here that meeting the guidelines, this is really just kind of a yes or no dichotomy. Either they're meeting them or they're not. So there's probably a pretty fair chunk in the middle that are doing some activity, but not necessarily hitting those guidelines. And that's awesome and should continue. But, for the most part, cancer survivors are also kind of, I would say, probably similar to the general population in levels of activity. So, why does all of this matter for cancer? Well, we know that physical activity, there's enough evidence to say pretty specifically that physical activity reduces the risk of these 7 different types of cancer. So there's been a lot of research, there's enough research accumulated to say, yes, that these types of cancer are impacted by physical activity, and you can reduce your risk by being physically active. We also know that about 3% total of new cancer cases every year in men and women combined can be attributed to physical activity, inactivity. So 3% doesn't sound like a huge percent, but when you consider that there's estimated to be almost 2 million cancer diagnoses in this country this year, you're talking upwards of 50, 60,000 cancer cases that could potentially be reduced or prevented through physical activity. So we know that there's great evidence for those 7 cancer types, but what about the other cancer types? So there's more and more evidence emerging that that physical activity is related to a reduced risk of more cancer types. So this was a study looking at 1.4 million adults and their physical activity levels and risk of certain different types of cancer. And what this study showed was that for those with the highest levels of physical activity, they had a reduced risk of getting these 13 different types of cancer. So the 7 that we kind of know about, the evidence is very strong for, plus additional cancer types like myeloid leukemia, myeloma, bladder cancer, a number of others. So the evidence does continue to grow, and I think we'll probably be officially adding to that list of 7 in the next iteration of different guidelines that are published. This was a study done by my colleague, Dr. Reese Punya, looking at physical activity and association with reduced risk of myeloid leukemia. So in this chart, she shows that as the amount of physical activity goes up, the risk of developing myeloid leukemia goes down. And it's actually especially pronounced for a subtype of myeloid leukemia called MDS. So more research to kind of underpin the idea that there are other cancer types that could be affected by physical activity. Okay, so that's great. We really want people to be physically active. We know it can help reduce risk, but it's certainly not a guarantee. It's one risk factor. People get cancer all the time for reasons that are unknown or for, without any obvious risk factors. So what happens if you end up getting diagnosed with cancer? Is there a role for exercise? Well, we know that there are currently 18 million people alive in the United States with a history of cancer. And as early detection and treatments continue to improve, that number is only going to go up, which is great. But it's really important that in addition to us understanding how to prevent cancer, we also need to know how to increase survival, but also how to increase the quality of those years that people are alive having had a cancer diagnosis. So with regard to increasing survival, this study looked at cancer survivors and their levels of physical activity, either before they were diagnosed or after they were diagnosed, and whether that impacted their risk of death from their cancer. So in the top part of the chart, we're looking at pre-diagnosis physical activity. So these are people who are very physically active, they get diagnosed with cancer, and they're looking at their levels of activity prior to that diagnosis and whether it impacts their outcomes. So here you can see that there are a number of cancer types for which being physically active prior to a diagnosis helps reduce the risk of death from those cancer types. And then in the bottom part of the chart, we're looking at people who are very active after a cancer diagnosis. Either they continue to be active or maybe they got active after their diagnosis. And we see here that there are a few types of cancer that there's enough evidence to say that physical activity after a diagnosis helps improve their outcomes and decreases mortality. So in summary, among survivors of breast, colorectal, esophageal, hematologic, liver, lung, and stomach cancers, those who were very active before their diagnosis had a significantly lower risk of dying compared to those who weren't active. And then for survivors of breast, colorectal, and prostate who were active after their diagnosis, there was a significantly lower risk of dying from that cancer. So really, this essentially suggests that even for people who get cancer, there is something that you can do to potentially reduce your risk of dying from it. And then this is a chart from our ACS guideline, Nutrition and Physical Activity Guidelines for Cancer Survivors. And if you look at just the physical activity column, you see that there is strong evidence that for survivors of breast, colorectal, prostate, endometrial, ovarian, and some evidence for lung, that physical activity improves outcomes, so reduces the risk of death from those cancer types. And I'll just point out, the other cancer types for which the cells are blank. It's really because there just isn't enough research on people with those types of cancers to be able to make a specific recommendation one way or another. But, for the most part, I think it's safe to say that physical activity is probably beneficial to many more different types of cancer survivors than just the ones in green. So these are our Nutrition and Physical Activity Guidelines for Cancer Survivors, which were published in 2022. And we specifically make a recommendation that for cancer survivors, whether long-term survivors or people in active treatment, that getting regular physical activity is important. Of course, and especially for people with inactive treatment, this activity plan really needs to be done safely. So taking into account any treatments you've had, any side effects of those treatments, if people are just recovering from surgery or something like that. But for the most part, you see benefit for cancer survivors with physical activity, including for people who are in the middle of active treatment. Okay, but living or dying from cancer is not the only issue that people with cancer face. We know that a diagnosis is associated with physical, psychological, and social needs that we often kind of group together as one term called quality of life or overall wellness. This could be physical or mental. A lot of the physical kind of quality of life issues are around things like pain, fatigue, bone fractures, feeling sick, like nauseous. Mental quality of life issues can be around depression, anxiety, kind of a loss in cognitive function. So does being physically active help alleviate any of those and help improve quality of life? So there were two large literature reviews done in the last few years that resulted in guidelines from two major organizations. One was from the American College of Sports Medicine, and the other from ASCO, the American Society for Clinical Oncology. And both showed that physical activity can help reduce fatigue, which is the most common side effect of cancer treatment. It improves symptoms of depression and anxiety. And that's true for people in general. There's been a lot of research showing that physical activity can really help with reducing, especially symptoms of anxiety. Improves sleep, it helps maintain physical functioning, and improves immune system, appetite, muscle strength, and range of motion in cancer survivors. And here's another study looking at survivors and their different measures of mental and physical quality of life. So you can see as their physical activity levels go up, that their physical health scores and their mental health scores both go up. And this is true of long-term survivors as well as short-term survivors, or people who are closer to their diagnosis. In fact, the research is so strong related to issues of quality of life among cancer survivors that the American College of Sports Medicine is able to publish these essentially exercise prescriptions for cancer survivors. So this is kind of a busy slide, and I don't expect you to read it all, but just as an example, if someone's experiencing cancer-related fatigue, there's a very specific amount of physical activity that's been shown to help with that. So 3 times a week of 30 minutes of moderate intensity aerobic only, or 2 times a week of 2 sets of 12 to 15 reps of resistance only, or a combination of the two. So there's lots of research. We can be pretty specific about the amount of physical activity that's needed to address some of these health-related outcomes and side effects for cancer patients and cancer survivors. So it's generally like a pretty great idea for people to try to be physically active if they can. And, we know there's lots of evidence for a number of these factors, but not for all of them. So there are things like questions that are kind of unresolved. Can physical activity help with things like neuropathy, with cardiotoxicity, with nausea and pain? So those are all things that more research is currently happening, and that we really need to know more before we can make recommendations about those things. So in conclusion, we know that physical activity can reduce the risk of at least 7 different cancer types and probably more. For cancer survivors, including those who are in active treatment, physical activity can reduce the risk of dying from some types of cancer and can improve physical and mental quality of life. And we also know we've probably got more work to do to increase physical activity levels in this country. I know there are people on the call who aren't from the US. I am not really familiar with what some of those physical activity levels are in other countries. We can be pretty certain that the health benefits would translate. But as far as, there's probably other countries out there who are doing a little bit better than we are in the US, but, there's probably always room for improvement. So that is it for me. And I guess we can take questions now.
Thank you. You stuck to the time, unlike some of us. We have, we have a few minutes if others, I've seen a lot of activity. Thank you, Kristen. That was really helpful. And you have me thinking about all kinds of stuff for myself, as well as this group. So let's see. Anyone wonder? Oh, Connie, go for it. Oh, you're muted. I can ask you to.
Okay. Hey, I just really want to comment on the physical activity because it really pertains to me. I went into my leukemia 12 years ago. When I went into it, I was the organic, healthy eating, walked all the time. And I was actually embarrassed that I got cancer because I was like, how can this happen? I'm so healthy. But I went into it when I would be in the hospital every day. I would tell myself I'm going to get up and I'm going to do 3 laps around the floor. Some days I didn't do it, but it was my goal every day. Now I was waiting for my transplant, and after I would walk 3+ miles almost every day. And basically, I got cancer in November, was in remission in January, had a bone marrow transplant in May, and was back to work the following November. So I just stress the physical activity for your mind and your body.
Yeah, I mean, that's such an amazing story. That's very inspirational. And I mean, I do understand that, especially when people are not feeling well, you're feeling at your worst, how hard it can be to make yourself get up and do that. You know, and I think, especially for people with specific side effects, like I think it's encouraging to hear not just, oh, physical activity will help, but that if you're experiencing fatigue, if you're experiencing, you know, anxiety, who isn't, that these things, you know, doing this specific thing will help, has been shown to help with that. So I think it can be motivating for people to understand, you know, the specifics of what it might help with, not just some general, you know, maybe idea of better health.
Taylor, do you want to unmute and ask your question?
Yeah, I was just wondering if there were any specific types of physical activity you recommend, like more than others, like best bang for your buck type of things, or just follow the general guidelines?
Really depends. I mean, it depends where people are starting from. I think for people who are not necessarily active now, maybe just starting to be active, I mean, you really can't beat walking. It's pretty accessible for most people. You don't need any fancy equipment. You can go as slow or as fast as you want. You can work up. You don't need any specific like skill to be able to do it. But I think, you know, just generally those federal guidelines of trying to get some amount of aerobic activity, which brisk walking would count towards that, plus muscle and bone strengthening is really important. I mean, I'm not sure how old people are on this call, but especially for women, as you get towards middle age and you start to lose lean muscle mass, it's just so important to try to keep that and build it up a little bit. Keep your bones strong and your muscles strong. That will keep you kind of functioning into as you get older. So I think, you know, the strength training or some sort of resistance training is really important as well, especially at certain ages.
And just one more question. Where would you put like yoga under the tree of aerobic or?
Yeah, well, you know what? There's so many different kinds of yoga. I mean, some yoga, you're really like sweating and breathing hard. I mean, I think if it raises your heart rate, it would be considered, that type would be considered moderate physical activity or even into vigorous. But otherwise, I think it's still considered kind of resistance or strength training or resistance training because you are holding your body weight and, you know, those poses are kind of building your muscles as you do that.
Thank you so much. Appreciate it.
Was one, I think you sort of got to this answer, but it was one more question I saw in the chat. Any thoughts of studying, or maybe you're aware of ACS looking at this or other groups studying people with chronic fatigue, and you mentioned the challenges there, or long COVID or other types of conditions that limit capacity for energy expenditure? That's really interesting.
That is interesting. I don't think we are necessarily doing that. You know, we really try to kind of focus our research efforts on risk of cancer and cancer survivors. But I do think, and especially with long COVID now, I mean, I think it's such an area of opportunity to try to figure out what's going on and what might help. You know, I think the research has shown that physical activity can help with fatigue that's related to cancer treatment, but is that the same as chronic fatigue or fatigue from long COVID? I don't think we know. So very interesting though.
Actually, Dr. Cunningham says, not my area of expertise. Seems like the chronic fatigue, long COVID literature suggests different pathways and excessive exercise may make things worse. Lots of interesting research in this area in infectious disease, inflammation, rheumatology.
Yeah. I mean, I think there was some research that came out kind of early on in COVID showing that people who had high physical activity levels kind of fared better when they got COVID, which isn't really surprising. It can help control inflammation. But I think long COVID is a completely different animal.
Yeah. Well, I know we should probably move on. Great questions, great presentation. Thank you so much, Kristen, for that. And I did drop in. I mean, one thing is we specifically asked Kristen to speak to physical activity this year, because in the past we've had a doctor with us talking about food and thoughts there around, limiting inflammation. Kristen's also very aware of that, but we asked her to cut it off physical activity. But so thank you so much. We wanted to make sure we brought in sort of the different, right? Think about the different menu of ways you can, keep healthy and limit inflammation. So I did drop in a link to a video from a couple of years ago about food that we offered. So thank you again, Kristen. I appreciate your flexibility on time
All
today.
Thanks for having me. It was nice to be here.
It was good.